Good afternoon. I'm Governor John Carney here for the second of our biweekly press briefings on Delaware's response to COVID-19. I'm joined by A.J. Schall, the Director of Delaware Emergency Management Agency, again, our point person on all these activities, and Dr. Karyl Rattay, who's the Director of the Division of Public Health. And again, I want to use this opportunity to thank the teams at DEMA and at Public Health, in particular our first responders, and most importantly, the hospital workers on the front line doing all the testing in our state. Just continue to do an incredible job. I know it's wearing them down. I know that they feel and experience the stress of it all, and I just can't thank them enough, and I can't thank these two folks on either side of me for their leadership. Every day seems to be a new and more difficult problem, a problem that we've never encountered before. I certainly haven't, as in my 30 years of public service as an elected and appointed official. I don't think I've ever been as proud as I have over the last 2 months in Delaware as a state of neighbors, everybody pulling together, of our team here in Public Health and Health and Social Services, Department of Labor, DEMA, our Department of Corrections, you name it, Department of Agriculture, every agency of state government, every essential employee for state and local governments, and of course across the economy. You know, many businesses are shut down, and I hear the anguish in their voices. We've started up this week statewide Zoom calls by geographic area. We did Eastern Sussex County, Western Sussex County, I think Greater Newcastle, Greater Newark earlier this week, and I was able to listen in. I got a comment on our Facebook page challenging me, asking me to participate, to listen in to those Zoom meetings, and I decided to do that. And also, I talk all the time with my staff and those who do participate, and I want everybody to know that we're not just making decisions based on the data. That's an important driver of it, but it's balanced off against the public support or not for the restrictions that we put in place. It is with a measure of the economic impact, negative economic impact and business impact on workers and business owners alike. You've heard me say before how it hurts my heart to hear the anguish of both workers and business people about their businesses being closed down, particularly our hospitality industry and the workers who are out of jobs as well. Thankfully, we have resources provided through the federal stimulus packages, with another one just recently approved that will replenish the small business fund, and we thank our congressional delegation for that. This has been a very difficult and challenging week as we have really leaned into addressing the outbreak there among the poultry worker community in southern Kent County and Sussex County, and with a two-tracked approach to it, and working hard to stand up the testing plans at the plants. A little frustration there with how long it's taking, and our community testing, and the two community testing sites prior to today, and I know we had one there today, and we thank our partners at Bay Health in Milford and BB there, who did their testing site the other day in Georgetown. We've tested over 1,000 members of the community, which is as good as an outreach for testing that we've done throughout the last 2 months. We've also had additional community testing in areas of greater Wilmington and Newcastle County with a higher number of COVID-19 positive cases. And so one of the things that we're wrestling with, and we're seeing as a result of that over-testing in the so-called hotspot areas, and we did identify western Sussex County as a hotspot area with an attempt to really get everybody to adhere to the guidance and the social distancing and protections with face mask coverings and the like. We're really leaning into areas in Newcastle County that have a higher number of cases and doing testing there. At the same time, developing a new testing plan, program, if you will, for the next phase, kind of the reopening phase. And I think what I've heard on the Zoom town hall meetings and from people I meet across our state, and as we were on the phone today with federal officials about these issues and getting advice on CDC with respect to our gradual opening criteria and with respect to our outreach to the issues in Sussex County. Below us in the Carville building was a protest, a pretty vocal protest on the front steps here, and I understand that there was a protest in Dover as well. And certainly, this is a great country. Everybody has the right to express their opinion, and folks are doing that. I guess I would have hoped that the protesters were more here to express their appreciation for what we're doing and their support for what we're doing, but obviously we hear and understand their opposition and their eagerness to get back to work. And that's what I heard on the Zoom town hall meetings, particularly with small business. It was very focused, very concerned about their individual situations, focused primarily on the gateway measures to moving from where we are today to start gradually reopening our economy. We're going to talk about we're going to show a few indicators later. But one of the more difficult challenges that we have, and I've been saying it for at least a week or so now, is that we've seen some real success in our efforts to flatten the curve, if you will. Mm-hmm. The cooperation that we've gotten from businesses across our state, from ordinary Delawareans, and not gathering in big groups and keeping social distancing and now wearing masks in public, keeping their businesses closed, as difficult as that might be, and not playing basketball on courts in our parks, and not going to our beaches, and all of those things. And I know it's wearing thin on everyone, and I understand that. And those are the things that I kind of keep in mind in addition to the data as we think about moving forward. But the difficulty we'll have, and it'll be illustrated in the graphs you'll see in a minute, is what are the criteria that you're really going to use to say, okay, now's the time to gradually move to phase one. And we're getting close to identifying just what those criteria would be. One of the things that we know, that the criteria that was kind of central to the recommendations out of the White House Task Force and the CDC, was the daily, a 14-day decline in the daily new positive COVID-19 cases. And we're not going to see that because we're over-testing in areas where we see these outbreaks. We're having an outbreak like we do in Sussex County, and we'll show that in some of the graphs. And so we're not getting a full state picture of the flattening out in other parts of the state, as well as a really dramatic, or at least noticeable, flattening out in hospitalizations, which is a really important indicator because it's real. We know it. The hospitals count it every day. We know what that number is. We know how many are in critical care and ICU. We know who those folks are. And we know that those numbers are flattening out and actually this week going down a little bit. And that's a measure to a certain extent of the severity of the positive cases that we're seeing. And also a measure, I think, of our ability to protect our senior citizens and those with compromised health conditions, because those are the conditions for whom COVID-19 is such a lethal virus and disease. And so it's a really good measure. It's a bit of a lagging indicator because it occurs a couple days, and Dr. Rattay might comment on this, a couple days after the infection. But it is at least one that is discrete. It's reflective both of trends in terms of the severity of the cases across our state. It will reflect the severity of those cases where we have that outbreak in Sussex County, and we'll see some of that. So I've gotten letters from members of the General Assembly about looking at that particular measure and urging us to move to opening up in phases our economy, and I appreciate their patience up until this point. We're not there yet, but we're getting there. We're going to try to meet all those conditions laid out by the CDC guidance and the White House task force. We know that we're going to have to come up with a different measure than day-to-day declining cases, and we'll do that and do it in a way that both recognizes the health risks to Delawareans, especially to vulnerable populations, and the damage, if you will, to the economy in our state, small business owners, larger businesses, and employees alike. So with that, I'd like to just move into our deck a little bit, and we'll talk about some of the graphs that kind of illustrate my point. We're almost to 5,000 positive cases now since March the 11th. Sadly, again, up to 159 total deaths. Again, the vast majority of those deaths are former residents of nursing homes, elderly senior citizens, many with existing health conditions. Only a few outside of that demographic. Notably, we've had 1,400 total recoveries. And again, here's a number that's decreasing, and one of the indicators that I think of the severity of the disease. Our hospitalizations down to 281 statewide total. And if you remember, all the way through this, our focus and so much of these protective measures is to protect the critical care hospital capacity behind that number. And the available capacity is twice plus what we see on the board. And I keep looking at AJ because he's the guy that's really been hawking that number, and we've been pleased with that and pleased with the hospital's cooperation one with another with respect to ventilators and resources. And we've stood up alternative care facilities, and we've not had to use them yet, and frankly, I don't think close to. So that's a really good positive condition on the ground. So Newcastle County, again, flattening out a little bit, still up, but at 1829. Kent County, same kind of scenario, flattening out a little bit. And then you have Sussex County, where you're the most positive cases in the state, and Sussex County has moved into the top, among the top 100 with the most accelerating cases in the country, sadly, and here we're really leaning into efforts to control this spread, to treat those who are COVID-19 positive, and to wrap our arms around their families and their communities, and importantly, to protect the workforce that's so essential for our national food chain in terms of poultry and the processing plants there, and hopefully getting closer to working with the plants on a testing program for those employees. Again, there are a number of cases that are unknown. The demographics stay pretty consistent across age categories. Again, most vulnerable, 65 and over, that we really need to lean into. And again, here you have an indication of the challenge that we face, right? So the up and down nature of the new cases by day, which, as I said at the top, was one of the indicators that the White House Task Force and the CDC has been recommending as a gateway measure of whether you're ready to move into the phases. And the up and down nature is a function of two things. It's a function of the regularity or not of the testing locations, and each of our testing locations are done by the hospitals, and the time it takes for the labs to return those results, which has varied anywhere from 5 days to 10 days or 2 weeks. Now, Christiana Care has the ability more recently to turn those tests around in a day. And then you see those two big spikes. Well, that's a day or two after our big community testing efforts in Sussex County. And we're going to you see a little dip there. That's because we weren't doing that in Sussex County, and you weren't having as much action with respect to new cases in the other part of the state. But what we're going to see in the next 2 days, we just tested 1,000, 1,100, over 1,100 folks there in that hotspot in Sussex County. You're going to see a spike up again. So we're trying to think through, okay, how do you get to a gateway measure that contemplates the status of the situation in all three counties statewide, while recognizing the particular challenge that you have. I would just recommend that everybody who wants to follow this data, and we're going to be looking at a dashboard of indicators to determine the criteria for moving forward. I would recommend that you go to our COVID-19 data dashboard on My Healthy Community. There on the Delaware.gov website, you can see the overview there. That's a snapshot of the first page, again with the number of deaths and the positive cases. That looks like from yesterday. So let's move into some of these metrics, and you can see current hospitalizations that are. This is a 14-day measure of the hospitalizations, because remember, we're talking about 14-day increments when you think about the CDC guidelines and the White House Task Force guidelines. And the wavy line is the actual number of current hospitalizations, and it's still trending upward, but flattening out. If we were to extend that graph to the left, to the vertical axis, you would see how that graph climbed at a much steeper rate earlier. Move on to the next one. That's new hospitalizations. So the new hospitalizations by day, and again, it's a 14-day interval, which is the measure we're looking at. That has a pretty good positive look to it, even with the new hospitalizations in Sussex County, and both the combination of those two kind of explain what we are seeing by the total number of hospitalizations in the first slide there. The next, we've talked about this, the fact that the variance from day to day in the number of positive cases being given the fact that we're more intensely or increasing the number of tests each day. And so one measure of that is to calculate the percentage of persons who are positive based with the number of tests you're doing in a particular day. And this happens to be a 5-day average. And so you can see it kind of smooths those big spikes out and also shows a bit of a downward trend. New positive cases, again, are very lumpy, as you would, even with calculation of a 5-day average, which is what this is, and pretty flat. That number going down, I must say, is going to blip up again because of the 1,000 tests over 1,000 tests that we did in Sussex County over the last 2 days. This is, those other charts were 14-day intervals. This takes you all the way back to December and shows you the dramatic increase of COVID-19-like illness by week, as well as flu-like illnesses by week. The flu-like illnesses, as reported by the hospitals, in the bottom flatter line, and you see the COVID-19-like illnesses reported in the upper graph, and so you see that dramatic run up. But at the end there, it's starting to flatten out, and that's really what we're looking for. If you just talk about cumulative positive cases, you're going to have a graph that looks like this, gradually moving upward, and doesn't provide much confidence that things are leveling off like the other measures do when you look at a 14-day snapshot of it. So those are the kinds of things we're looking at. We're using a kind of a dashboard approach to this, and we'll have some of the other indicators on our website in terms of hospital capacity, which is a requirement, in terms of, again, our testing capacity as we move to the new phase, as we talk about our contact tracking, tracing, as we move to the new phase, our ability to provide personal protective equipment for hospital workers and first responders is a measure there, and a number of others. Again, we've tried to point out some extraordinary work by members of the community, and here's just a slide on ILC Dover, which developed a powered air purifying respirator hoods for workers on front lines in only 5 weeks. Really good work there by ILC Dover. The next slide is just the series of amendments, and I should recognize and thank the Attorney General's office, in particular Alex Mackler, for his real help in all of that. They've been incredible, a partner in all the legal work required, and Alex in particular. So that's all I have in the deck. Look forward to your questions and turn it over to Dr. Rattay.
Great, thank you so much, Governor. Thank you for going over the data. The last thing I would want to do is spread false hope in any way, but as Governor Carney was saying, they're beginning to show a little bit of sign that maybe we're slowing down, but the reality is it is still not safe to be out in our communities. Seeing the increases in hospitalizations, increases in cases, or the trend of increases of cases, and continued increase in COVID-like illness or CLI are important signs that that we need to keep paying attention to. I think we're all eager to see those trends really flatten or go down, but the data just don't show that we are there yet. So testing is incredibly important. Important for us to identify who has the COVID virus, to then help people safely get into isolation, to identify who their contacts are, and to place those individuals in quarantine. We just had a call with the White House Task Force and the Centers for Disease Control earlier today, and they gave us a bit of good news about testing. They said we've tested 1.7% of our population, and that we are in the top 15 of states for testing. So
that's a good thing. I haven't heard that.
Yep, it was new news for us, and I really want to thank the hospitals for, over the past 2 months, having these sites throughout the state have been incredibly helpful for people to have access, especially people with symptoms. And as we've had limited amounts of testing available, being a collaborative state, we've been able to share resources and make sure that people across the state did have access to testing throughout all of this time. So in our hospitals, 25,000, or I should say from our hospital test sites, 25,000 tests have taken place already. And in our state lab, over 3,000 tests have been run. But we need to start ramping things up, and we are doing a lot of work in coordination with our hospitals, with primary care, talking with pharmacies and other partners to really ramp up testing in our state. Really, to safely reopen the state, we need 2 strategies implemented simultaneously. One is a testing strategy for anybody with symptoms must be able to have testing as soon as possible for the reasons I just mentioned. We want to get them isolated and find and follow up with their contacts. But another important strategy is also antibody testing, especially for asymptomatic individuals, essential employees. We're using a lot for outbreak investigation as well. And so we're looking to ramp up our testing on both fronts, and this is all underway right now. You've heard us talk a lot about, in the past, our testing is for symptomatic people, but that will change. So of course, symptomatic people need to be tested, but individuals who have been exposed to someone with COVID virus, especially those direct contacts, we're going to need for them to have access. Long-term care residents, members of vulnerable communities are a special area of focus, and those in the essential workforce. So you'll see more about that changing guidance as we go forward and ramp up our testing, but more people are going to be tested in the upcoming months, and that's an important piece for us preparing to open. So again, I just really want to thank our hospital partners, the primary care physicians in our state, federally qualified health centers, and our many other partners on the ground who have helped us get the testing and get into the top 15 of states in our nation for testing. I do want to touch on one more thing before I hand it off back to the governor. Contact tracing is, as we know, going to be a really important piece to reopening. We're doing a lot of work now to get that up, and we know that there are a number of people out there who are interested in contact tracing. So we are collecting emails now, and I want people to know that if you are interested or you have ideas, suggestions for us about contact tracing, send your email to dphcontacttracing@delaware.gov. So we're gathering all the interest and ideas from our state to help inform our process moving forward. And with that, I'll hand it back to the governor.
Yeah, and I'd just like to emphasize a couple points and ask you a question. First of all, great news with respect to how we stack up against other states with respect to the percentage of our population that we're testing. And I heard you say, and I know that you've been working hard kind of on the next phase of testing, which is really a requirement for gradually opening the economy. So you're going to be testing twice as many or more, and just I think some really good news there. And one thing I think that's important to point out, and you mentioned it a little bit, and you might mention how we're doing this in terms of community testing sites. And so far, we've relied, and they've been great. I mean, the hospitals, we just can't thank them enough. 25,000 tests statewide, really at those sites, but they're individual sites, 2 in Newcastle County and 2 in Sussex County and 1 in Kent County, 1 or 2 in Kent County by all of the hospitals. But one of the things I think I've heard from the hospitals themselves is there's a kind of weariness about those individual static sites, and so they've started to move out, as we have, to do more community testing sites that are more convenient to people, that we can target more vulnerable populations, and we've heard a lot of community input about that. And we've done testing through the LACC and on the Route 9 corridor, and I'm hearing they're going to move into Northeast Wilmington and Claymont, and then all the things happening in Sussex. Can you talk a little bit about that community engagement that goes behind determining where those sites are and maybe who our partners might be? And you mentioned several of them as we move into this next phase of testing.
Yeah, absolutely. This needs to be a data-driven approach for sure. So it's really important that we look at where are we testing now, which we have on our My Healthy Community website. You can see, which zip codes more people are being tested and which are not. We also have we've identified communities of more vulnerable populations through the work of Healthy Communities Delaware. And so we've identified 22 areas that we consider opportunity communities in the state. That means it's really, really important that we're making sure that we're addressing and ensuring that there's access in those areas of the state. We had a great conversation today with Newcastle County partners, including the county executive, Matt Myers, and all the hospitals and other providers in the state, in Newcastle County. And we're really looking at the data and looking to see where are we and where are we not, where do we need to expand to. And we all believe that it's going to have to be a multi-pronged approach. So, for example, some pharmacies, that would be a stationary site, but then other geographic locations that may be harder to reach, we're going to need to reach through mobile sites on an intermittent basis. So, we'll keep using the data so we can make sure that individuals have access.
Yeah, and I think the County Executive Meyer, is going to be a really big partner moving forward in terms of resources that he can bring to bear and his interest in helping us that. And of course, the more hands on deck, the better, and working with local community leaders and elected officials as well, and both identifying those sites and and figuring out different ways to logistically do the testing as well. AJ?
No, thank you, sir. So I think what Dr. Rattay and the governor is talking about really leads me into my first few slides, which is what we're doing to be proactive. So what are we doing to help those, as Dr. Rattay said, those at-risk communities out there? And it could be the poultry industry down in Sussex, or it could be the high-rises in Wilmington that have a large percentage of elderly people that we need to be concerned about as well. Over the last week, the Delaware National Guard, great partners throughout the SAL, have manually assembled over 7,500 care kits that are in process of being distributed around the state. We think we went over these last week. They have hand sanitizers, soap, face coverings, educational materials in multiple languages, and they are putting about 1,000 plus of those together a day as we get the supplies in to make sure we could get those to those communities to help lower that risk as much as possible. The other thing we're doing to help some of these vulnerable communities is, we talked about this before as well, but put some numbers around it today, is sheltering. So this is taking individuals from a area where maybe they were the infected one, or maybe they had to get away from somebody that was infected, and sheltering them with partners between Newcastle County Office of Emergency Management, Sussex County, the Homeless Task Force being run by a number of nonprofits, Department of Health and Social Services, Code Purple across the state, and I could list a dozen more. There's been over 600 individuals in the last month that have been placed, usually in a hotel type environment, to be taken out of an area where they were vulnerable, or maybe to take them away from other individuals. So it's activities like these that will help us, really manage the risk, and will help us see that sustained flattening of the curve as we go through this. So again, we couldn't do this without all these nonprofits.
And this is a part of our Sussex County outreach as well.
Absolutely. So we've done this in Sussex County, we've done this in Kent and Newcastle, really for about 6 weeks to different levels. Sussex County went in overdrive last week, brought 2 more hotels online, and really, as public health is at these community testing sites down there and testing somebody, if they are positive, or there might be somebody in their household that was positive, if we have to get them to an alternate sheltering arrangement, social services managing that right there on the ground with no delay to get them to a safe area. So again, we couldn't do that without the nonprofits across the state. Dr. Rattay stole a little bit of my thunder with what we're working on with Newcastle County, but it is very, very good news here. Again, data-driven approach to Newcastle County, just like everywhere across the state. The call today with the hospitals, the county executive, and others will really, I think, show very fruitful results very quickly. We know that the limiting factor here, as we talked about, is how quickly can we do tests. The labs could run them and provide those social services outreach to these individuals. So between St. Francis, Christiana Care, New Moors, and other partners, and then the nonprofits, you're going to see many more of these, mobile sites, kind of pop up, and it's going to be, where we think we need to concentrate on. We would love to say, hey, we're going to get through X number by the end of the month, but it's going to be a partnered approach, and there'll be definitely more to come on this as well. Sussex County, I just want to take a minute and kind of go over what we did this week. So Health and Social Services did a fantabulous job really getting community testing sites set up at the hospitals down there in about 3 days. It was Thursday and Friday of last week where we identified that we had to do more down there, as we saw some of the initial results from some of the poultry industry testing. And again, the hospitals, the nonprofits, and public health, and our partners over at Social Services pulled together and came up with a plan to get community centers open. Just about every day there'll be one open from a different hospital, a different location in these hotspots for several hours where they're doing tests and the social service activities. With that became a very comprehensive outreach message, because we wanted to make sure we got the message to the community in a way they could understand it and as quickly as possible. So we did everything from text messages to reverse 911 in 3 different languages, to utilizing school lunch pickup areas. So where parents and students were picking up their lunches, we were making sure we put education and notices in there where they could go to help. We using a United Way in our 211 feature even more, where they're now even, helping with translations and other obstacles that we've had before to really make sure we were successful. And then, we want to make sure people understood that's the hotspot right now. Whatever you could do to stay home, lower the risk is going to help us, and we'll see it much quicker than maybe we've seen in the last few weeks. So those public service announcements, including the billboards, will be updated as necessary. They will be on the COVID website at coronavirus.delaware.gov, and as we need to use our partners down there, we are doing as them in languages to make sure we get them to the making sure they are translated and appropriately disseminated out there. And we're open to any suggestions too. If there's we just Thursday we did some specific outreach to the Amish community in western Kent County as well. So we understand we have to be creative and very forward-leaning to make sure we are communicating in the right message to the right person at the right time. So with that, I'm going to turn it back over to the governor.
Yeah, I can't say enough about the partnership with the hospitals, the federally qualified health centers, Lared and Westside, with respect to their support for our efforts there in Sussex County to stand up those two testing sites very quickly, to actually 3 today being the third, and to test over 1,100 folks from the community and from all over Sussex County. We've not been able to be number 15 in the country without the partnership from the hospitals. In fact, they're the backbone of it, really. And this week, in particular, got assurances from them that they will continue to be partner with us and to be the backbone of that operation on a more distributed kind of site-based outreach, as opposed to just the big testing sites that have been the bulk of our operation over the last 6 weeks. So trying to really focus on making sure we're getting every community, every demographic, particularly the underserved, and those without transportation and kind of limited resources. And so really, really helpful there. The community organizations that we've teamed up with, and Megan Wallace and her group there in Sussex in particular, but up here in Wilmington and now Newcastle County as well, and Kent is really important. And then I can't emphasize enough, I talked about it a little bit at the top, with respect to the engagement that we have going on now with the Zoom calls. It's obviously the way we do public meetings now. It actually is pretty effective. I know people get frustrated, and we apologize for that everybody can't talk. Even if you meet publicly in an auditorium like this, everybody does. There's not enough time for everybody to talk, but you can take comments, on the chat board on the side, and I do listen to those, factor that into our decision making. It really is striking the right balance as we go to trigger to move into phase 1 and release some of these restrictions. And just to go back to what Dr. Rattay said, we're still in an increasing number of cases scenario, particularly in Sussex County. And our success in moving to the next phase will be how effectively we stay the course with respect to current social distancing. The social distancing and the restrictions on movement and large gatherings up until this point has been working. We are flattening the curve, but we're not quite there yet. We will use the data, use the input we get from folks, and part of that is how can you reopen your business sector safely, differently than maybe in the past. There are lots of different exceptions that we're considering in terms of allowing businesses to operate a little bit differently than they might otherwise be allowed by law, so that they have some revenue coming in. I know it's a balance that each of them have to strike with respect to what works for every business. But we are considering that as well, and we understand, as we saw the protests today in Dover and here in Wilmington, the sense of urgency that everybody has in getting back to the new normal. It's not going to be normal like we used to know it as long as the virus exists, and it will continue to exist without treatment, drugs, and we had some good news a little bit this week, and without the vaccine. So We're in this together. Just to emphasize the points for the last 6 weeks. Please stay at home. No large gatherings over 10 people. Make sure you're washing your hands, wearing your face covering when you can't social distance in public, and really protect your neighbors, and in particular our vulnerable populations, our senior citizens. And one of the things that I wanted you to think about, and I think about it with my brothers and sisters every day, is my own mother. You've heard me talk about my mom before. She gets lonely, I know, and it's important that we safely visit moms and dads, grandmoms and granddads, while protecting them because they're the most vulnerable. But they need to hear our voices. They need to see us to the extent possible. They need to stay safe. I've been taking my mom out on walks. She walks about 10 yards ahead of me down the street, and I walk behind her, and I know my brothers and sisters do the same. So think about that with your own parents and grandparents. I know that you do. And again, thank you to the media for being here so that we can give you an update and get the important messages out to the public. So with that, we'll take questions, some of which have been submitted, and I know we have people in the room.
Hey, Governor, Isabel Hughes with the News Journal.
Hi, Isabel.
Hey, so I guess kind of just two quick questions for you. The first is you've briefly addressed the protests in Dover, and that were downstairs earlier, and there were relatively large crowds for both. We estimated about 75 people for both, and some of them we saw not wearing face masks and clearly not social distancing. Do you have any concerns regarding that?
Yeah, I do have concerns. Obviously, they have free speech rights, and so you always want to be careful, particularly with respect to that. They don't have the right to put other people at risk, which is what happens when they're gathering kind of illegally. But, I just, as governor, don't want to go around picking for fights. I just don't think it's productive. I want people to work together. I would rather that they gather to, make their case with me in a kind of reasonable way, and I hear them. They have every right to do what they're doing. They do not have the right to do it in the way that they're doing it. But it's counterproductive, I think, to pick fights. Obviously we have to enforce some of the restrictions, and we've tried to do that respectfully but seriously. And I think that's the most effective way to do it. Obviously, the Attorney General has provided the advice for law enforcement. I've been very proud of law enforcement through this whole thing. Particularly the local town police officers and law enforcement, who are really up close and personal with so many of those communities with very sensitive issues, and just really proud of their response. But it's a serious situation, continues to be. I mean, our deaths now, we're almost 5,000 cases. We've got deaths over 150 now, and continuing to climb. And we do see some good news in there, but it's really not a time to let up in that respect, right? And I worry a little bit about what I see with my colleague governors across the country. Obviously, they have the right and responsibility and authority to do what they're doing, but I know that they don't have the conditions on the ground that the White House, President of the United States, and the CDC have laid out there to guide us. And so we need to I tried to lay out today the complexity of that for Delaware, because we do have a flat curve, and the question is, it's not like New York where it really crested into a big curve and then dropped down strongly on the other side, or is dropping down on the other side. Ours is more of a gradual up. It looks more than gradual depending on the scale, but if you correct for some of the noise, it does look pretty gradual, and we're at the point, I hope, where we're going to start turning down. In the meantime, we're going to get ready and be ready. We don't want to delay it a day. But people need to understand, it's not time to let up. And the more we put into it now, the sooner it'll come. And that's a tough message.
And then just briefly, a second question. So you mentioned a little bit earlier that you take into consideration, public, support of the shutdowns, and House Republicans sent you a letter yesterday saying, they generally have, supported your efforts and whatnot. But obviously now they're kind of pushing to reopen the economy, reopen the state. Is there anything in the letter from yesterday that kind of gave you pause or made you think, hey, this is something I know you...
No, absolutely. I addressed it head on. It's that measure, and they raised it, and it's not a new conversation. We have regular conference calls with the leadership of the General Assembly, which includes the House Republicans, and that's who the letter came from. And Danny Short and I got into it on the call, had a conversation about just that issue, which is you're testing into, we use some metaphors, and I'm not sure, we talked about fishing into a fishing hole where there are lots of fish. You're going to catch more fish, right? And not to torture that discussion, but he's right. And so it's not going to, and that was directly raised in the letter. And so that's why I wanted specifically to address that challenge. And I've said it before, we need multiple measures, I think. Hospitalizations is the one, it's discrete, we know it, and it's an indicator, it's a lagging indicator of incidence, but it's an indicator of severity, right? Most of the people get COVID-19 and they survive. I don't know the long-term health effects, and I'm sure they're not great, and so we don't want that to happen, but it's really the vulnerable populations that you worry about, and so that's where all this other carnage results from the shutdowns. And so I appreciate and hear the same. They are reflecting the constituents that they represent, and that's their responsibility. My responsibility is for all the constituents across the state and to balance out what are, I think, really difficult decisions. I've said it day after day. The decisions ahead of us are harder than the decisions behind us. And this is the perfect example. And they've supported what we've been doing. They've been respectful. I thought their letter was respectful. I don't agree with the final conclusion. Let's go now. I do agree that particular measure needs to be looked at and maybe not relied on so much, and that's what we're saying today. But we do need to get to and the other thing that's a little concerning is that the vast majority of them represent an area where the biggest outbreak is right now. And our success in preventing that spread will depend on everybody else outside of those communities and those communities themselves buying into the restrictions in place. And so sending a signal that now's the time to let up, particularly there, I just would say is not the right signal.
Thank you, Governor.
The next question is from Sean Green at WDEL. He says, with Sussex County being a hotspot and the rate of COVID-19 cases in Newcastle County and Kent County continuing to drift downward, what are your thoughts on reopening Delaware using a county-by-county method?
Yeah, I'd rather not do it that way. There may be certain things that we can do that way. Obviously, you'd have to make a decision on the beaches just as it applied to Sussex County, because we don't have beaches up here other than the Bay beaches in Kent County. But I think what you want to focus on, obviously, is the conditions, and Sean has it right in terms of what we're seeing. But you need to think about people move county boundaries. The virus sees no boundaries, doesn't see state boundaries, doesn't see county boundaries. So to the extent that you could loosen something up that's very discrete, and you don't have a lot of cross-boundary movement for, I don't know, a particular product or store that might be open, maybe there's an opportunity there. And again, we're going to look at those specifics with the feedback of the private sector.
From the Delaware Public Media, can you give us a sense of the rates of positive cases among asymptomatic people tested at the community testing events in Sussex County? And as more tests are being done, will the Division of Public Health start breaking down the symptomatic versus asymptomatic positives?
I'm going to turn it up right away to Dr. Rattay, just to say that one of the disturbing things was that we had asymptomatic people that were testing positive.
Yeah, I think that's probably the most important point is that I've said it before in the last week or so, I think that's been one of the biggest surprises is how prevalent asymptomatic infection is. I don't have the numbers yet from the downstate testing sites. Those are the first few sites where we have been testing asymptomatic people, and I do think it's an important question to ask. One thing that I will emphasize is important, it does, just from preliminary data, it does appear that we see differences even, certainly in different counties and in different parts of the county. So those testing events are really really focused, as the governor was saying, more on the western and somewhat central part of the county, and especially for individuals who are family members are part of the poultry plant industry or other similar large industries, or somebody who knows somebody who's COVID positive. So you would expect to see higher rates of symptomatic infection compared to individuals maybe from the beach parts of the county, which from just preliminary data is what we saw.
And in lines with the testing, Melissa Steele at the Cape Gazette asks, where is the state on acquiring more test kits and what kind of tests are you seeking?
Yeah, so it's a great question. And as we've said many times, accessing testing materials has been a challenge for us and for everyone. We have been using more and more an antibody test, which is a good test for asymptomatic individuals. That is a blood test, so it's a finger stick, and you can get results in about 10 minutes from that test. So we're beginning to use that more in our community sites, and we are expecting more of that test in Delaware soon. We had, as I mentioned, a conversation with the White House Task Force on this topic today, and we have a request for some certain testing supplies. It looks like we may not be getting the specific supplies that we need, but through the creativity and really willingness of our hospital partners, we're going to continue to certainly make sure that the nasal swab or the PCR diagnostic test is available, and even available more so that we can get quicker turnarounds for people. We don't want to wait 3 days or 5 days for results. That's really not helpful. So I think we have a good strategy in partnership with our hospitals and our other partners to do that kind of joint approach with the finger stick antibody test and the nasal swab PCR test.
It's a good point to step in, I think, and that is to make an observation. We have NGA governors' calls with the White House Task Force on a weekly basis, and every governor in the country has been calling on, at the national level, to have access to more testing. And so there's incredible competition now as we all start to move to the next phase, ramping up testing in order to allow people to go back to work and circulate more. So we'll be managing that risk by testing, isolating, and contact tracing. And so if there's one thing, and I don't want to sound like a dead horse, beating a dead horse, but that the federal government can help us with, it's testing, and testing equipment and materials and swabs and reagent and all of that. And we've had at least two calls today where that was a big issue of the conversation.
There was a big change this week with the requirement of cloth face coverings to be worn in public. Matt Biddle at the Delaware State News asked, who is enforcing the mask ordinance? How strictly is it being enforced? And they've heard reports of some people blatantly ignoring these new guidelines.
Yeah, so that kind of goes back to my response to an earlier question about enforcement. We do have guidance from the Attorney General's office. We do rely pretty heavily on voluntary compliance for that. I know I get mostly from people who are upset about others that they run into, either workers in stores that are open grocery store worker who has a customer that doesn't have a face covering, and that's disturbing. But it's a delicate balance in terms of approaching people that don't. We try to just do that and do it in a serious manner, respectfully, both as individuals and as law enforcement. I know I've talked to local officials. The issue came up on our call with Wilmington City Council this week, and obviously conversations with the mayor and Chief Tracy, and just trying to strike the right balance there. It's a very difficult question. We really do rely on voluntary compliance, but we have to show that there's teeth behind it, and it's really for everybody's benefit and good.
Tom Lehman from WBOC asked, do you have any updated figures on the budget deficit? And are there any specific moves or cuts you anticipate making to address the anticipated shortfall?
It's big. I don't have, the direct answer is I don't have any updated numbers other than the DFAC numbers of, I guess, a week ago, something north of $700 million deficit going into next year. The deficit this year was somewhere in the $100 to $200 million range, which is, given the reserves that we have, certainly something that we can manage through, but it will take some doing. But it's at the same time that we're doing this, that we're getting requests for all kinds of support, from support for small businesses, to support from undocumented immigrants, to support for communities, and we're focusing our energy and support on these communities where the outbreak, we're seeing that outbreak there in Sussex County, and ramping up our testing and our contact tracing, and now working together with the county executive and resources he has available. There's a lot of spending that's going to happen, and there's not going to be enough money.
We've got two final questions. One's from Doug Rainey at the Delaware Business Now. He asks, is the state giving any thought to greater transparency in reporting statistics, similar to practices that have been seen in the state's correctional system? Elsewhere, other states such as Maryland, they're seeing COVID cases being listed for production plants, nursing homes, et cetera, that are at the center of the outbreaks.
We're pretty transparent with respect to the website and the breakdown. We now have increasingly more and more testing data by race, by ethnicity. We don't have a total data set. Out of the 29,000, I think we're missing 3,000-ish, something like that, which is not ideal, but gives us an indicator of whether there's under testing in certain areas. I haven't seen that. In fact, in the minority communities, arguably it's over testing or testing beyond the percentage in the population, but that's a function of infection as well, because we're testing those that are symptomatic. So we'll continue to try to have as much transparency in those numbers as well. I'm not sure we can do it employment center by employment center. I know even that sometimes census tract by census tract creates HIPAA problems, but Dr. Rattay, anything there?
Yeah, I would agree. It's both a logistical challenge in many ways to do it employment by employment, but also, as we've talked about the importance of protecting privacy, especially when it's like one or two people. But I do really want to encourage people to go to My Healthy Community, the website. I think just about every day we're adding more information, and as we can, we will continue to add more and more information for the public to see, as much as they can about what we know.
And when you do that, don't just look at positive cases, but also look at the number of tests in a certain subcategory. Compare that with positive cases, and do the math to figure out the percentages to get a more accurate picture, and to use the cases per 1,000 or 10,000, so you really do have the intensity. And you look at that map that they have on the website, and you have cases per 1,000 or 10,000, certain areas really light up. But you look at just the absolute number of the cases, it's in some cases maybe not as much as another zip code that has lots more people. So
The final question's from Sean Green at WDEL. He says it's supposed to be close to 70 degrees and sunny both days this weekend. How is the state planning to deal with the likely prospect of a rush to parks and beaches, and any thoughts you might have or kind of words of wisdom for people that might be considering going outside this weekend?
I find myself praying for rain these days so that we can more effectively have social distancing. It's hard, you know. It's spring. It's going to be beautiful out. People are going to be outside. I just kind of go back to the overall objective, which everybody wants: to be able to go to the park every day, to be able to go to the beach again, to be able to, you know, to play a basketball game on a court with actually a rim on the backboard, to do all the things we love to do in big groups, you know, to go visit your mother with her grandchildren. And so we're not going to get to that state unless we start getting on the downward trend here. We're getting better. And the actions we've taken are working. We have this outbreak and it's serious, and we're really leaning into it. But if we kind of ruin that by, you know, doing something it will feel great, it'll be great to do, but it could have very negative consequences, then it's counterproductive. And that's all I can say. I'm sure it's not very convincing to folks, but we're in this together. If we stick together, we really lean into it, we can get it out of it sooner rather than later, and go back to a new normal, which will include some social distancing until we have a vaccine, which will include some remote business activities, which will include restaurants with, you know, smaller capacities, tables maybe more spread out, whatever those things might be. And, you know, it's a time, I think about it in the context of my own lifetime, you know, as a 63-year-old, whatever I am. It's been the most challenging, you know. I think of my own father, who talks about growing up in the Depression and not having anything, growing up in West Philadelphia, and his father had died a result of mustard gas poisoning from World War I, and being kind of alone with his mother, and then you know, then World War II, and all of that. And, you know, this is our test. You know, this is the test of this time and of this generation, and we'll be measured by it with history as to how we responded. Did we respond with more of a community sense, the sense that as Delawareans we're all neighbors, or will we respond more selfishly with respect to thinking about just ourselves? And for me, my responsibility is to consider everybody in our state and make decisions to protect their health and welfare, and at the end of the day, let the chips fall where they may. And that's the way I'm going to approach the decisions. I don't make these decisions by myself, not even close. I've got a great team in public health, Department of Health and Social Services, DEMA, first responders, local officials, mayors, business leaders, everybody across our state, even the protesters out there, reminding us that this is the United States of America, and all the rest of it. And then my job is every now and then to sift through all of that and figure out what's the best thing for the people of our state, every single one. And that's the way we try to do it. So thank you again for joining us today. Have a good weekend. If it's nice out there, enjoy it, but separate from one another. Follow the restrictions, and we'll get out of this together.